in my clinical practice for last 2 decades. If you see the problem status, ICMR has given us this data. In this year, that is 2020 itself, over 17 lakh new cancer cases in India are expected. About 8.8 lakh cancer deaths. And topping the list are breast, lung, and cervical cancers. If you see the chart here at the base, unfortunately, 80% of Indians consult doctors when recovery is difficult. 71% of deaths that are occurring in India is between 30 and 69 years of age, unlike other countries like US, where 50% of death is above 70 years. That means in our country, we are having major cancer patients dying in the age which is considered to be most fruitful age of life. 70% of cancer patients detected in India die within 1 year of detection. And another very interesting observation which is found is 50% of the cancers, they are having direct relation with the lifestyle factors, maybe diet and lifestyle. It may also include obesity and use of tobacco, smoking, alcohol, etc. That means 50% of cancers are preventable. So this is the place where Ayurveda has a lot to offer. Another unfortunate situation is that 15% of pediatric cancer cases are observed in India, whereas in global status, if you observe, it's only 0.5%. If you see the geography of cancer, in Northeast, the incidence is number 1. You are from northeastern part of the country. When I consider northeastern states like Assam, Arunachal Pradesh, etc., they are ranking number 1, and West Bengal ranks number 2 in cancer incidence in our country. In Northeast, it is mostly the esophageal cancer which is seen as most common, and in West Bengal, CA lungs, urinary bladder are more common. Maybe water and air pollution are the culprits here. There is a changing pattern in cancer incidence. If you see, cervical cancer was topmost earlier in females, but now the incidences of cervical cancer are being reduced, most probably because of awareness, and females above 40 years of age are regularly going for gynecological checkup and pap smear examination. That may be the reason why cervical cancer incidences are reducing. But stomach cancer incidences are increasing. Lung cancer is still very high. Oral cancer cases are increasing, especially in men. Breast cancer cases are almost at the same level, but unfortunate situation is that in younger women, we are observing more cases of breast cancer. Ayurveda, being an age-old health science, the system of life, because of its strong, valid scientific therapeutic principles, and also treasures of the medicines that we have, very potent, safe herbal and herbomineral products, it is expected to give an assuring answer to this problem. The excruciating experience of dying cancer patients can be definitely ameliorated by making use of Ayurvedic principles. Ayurveda can help in different levels of cancer approach. It may be prophylactic, palliative, curative, supportive. In all these areas, Ayurveda can help. It is not that you cannot use Ayurveda in any type of cancer or any stage. Even if it is a terminal stage of cancer, you can improve the quality of life. You can bring smile in the face of patient when you adopt Ayurvedic principles properly. Prophylactically, there is no doubt that cancer prevention is quite possible by following proper dietary advice, dinacharya, ritucharya, and rasayana of Ayurveda. Palliative, many a times concurrently with other modern oncological approach, and in some cases even curative is also possible with the help of Ayurveda. Now, before going into directly into the application of herbomineral formulations, let us try to understand how cancer is mentioned in our classes. There is a wrong opinion among the people that cancer is arbuda. We cannot translate cancer into a single disease entity that is mentioned in Ayurveda. So that is my purpose here in these initial slides. So I feel is that there can be three different classification here. First is diseases which can be labeled as clear malignancy. There is no doubt that it is malignant. Second is diseases which may be considered as malignant, need not be malignant always. Third are the diseases presenting symptoms similar to malignancy. In one particular stage, they may look like malignant. Let me slightly elaborate this. In this group 1, based on three doshas, when you classify the diseases, if we are considering clear malignancies, that includes arbuda and some types of granthi. Say, for example, we have mamsa arbuda, which can be correlated with sarcomas, and rakta arbuda, that can be correlated with leukemia, or mukha arbuda, like oral cancer, or asadhya vrana, that is incurable malignant. We can have another category or second group where diseases that may be cancer or probable malignancies need not be cancer always. For example, mamsaja oshtaroga, which may be verrucous type of cancer, or asadhya galagada, that is incurable thyroid tumor, tridoshaja gulma, asadhya udara roga, many type of abdominal tumors or metastatic deposits or malignant ascites may exhibit in the form of asadhya udara roga. In third group, diseases that may have the possibility of malignancy, but in many of the situations they are not malignant. Maybe a type of visarpa may end up with malignancy. Do not say that visarpa is always herpes or cellulitis. Asadhya kamala or incurable jaundice, there can be obstructive type of jaundice which is manifesting either because of a CA of liver, like hepatocellular carcinoma, or it may also occur because of the cancer in gallbladder. Even asadhya pradara, intractable leukemia, which is possible in the case of cancer of cervix and even in the case of cancer of uterus, or even in the case of ovarian cancer. Tridosha janadi vrana, that can be intractable sinuses. So when I see this, I will just show you some of the pictures to make it very clear that cancer is not always equivalent to arbuda only. So this is mamsaja oshtha, comparable with mamsaja oshtha and mukaroga, which is nothing but verrucous cancer of lip. This is a very fulminant type of cancer. Alasa, probably it can be correlated with adenocystic and mucoid epidermoid tumors of salivary glands. We have galaudha, which can be correlated with carcinoma of oropharynx. Mamsa kachapa, which can be correlated with the tumor of hard pellet, or asadhya galaganda, which can be correlated with the papillary carcinoma of thyroid gland. Tridoshaja gulma, in asadhya gulma, which gradually increases in the size, widespread, fixed with a tortoise-like mass on abdomen, where skin over the mass shows engorgement of the veins. Along with that, patient is having kayachikitsha, cough, vomiting, fever, etc. symptoms. So these are probably suggestive of intra-abdominal malignant growth. Intra-abdominal malignant growth may be the deposits in omentum because of some other primary cancer, maybe CA ovaries can cause deposits in omentum, or it may be primary hepatocellular carcinoma, or some types of lymphoma also can show different masses in abdomen. So with or without ascites, you can have this type of presentation, which may be a type of gulma, may not be arbuda. So like that, if you want to understand this cancer based on Ayurvedic principles, you should not limit yourselves to arbuda, but it can be seen in many other diseases also. You can see here, this is the asadhya vrana, where different types of cancers are manifested. Lingarsha, for example, which is the papillary carcinoma of the penis. So even Tridosha Janadi Vrana, Asadhya Pradara, Asadhya Udara, Asadhya Kamala can also be there. This is some basic idea for you about cancer that is mentioned in our Ayurvedic classics in different contexts. It can be Grahani, it can be Gulma, it can be Mukharoga, it can be Arbuda, it can be Granthi, it can be Galaganda, and so many conditions. When you see Kayachikitsha, you will find very simple some line of treatment, which may not be applicable in all types of cancer, which you will be studying in your classes also. Today, I will be focusing on herbomineral formulations, but before that, in the beginning, I would like to just introduce the approach that we were following here in our institute for last 16 years. We developed a multi-dimensional approach for cancer management entitled as Mahoshadha Kalpa. This is a multi-dimensional holistic treatment based on the concept of Bhagavan Buddha, an indigenously researched practical approach. And here we have found that early treatment gives best results and there will not be any adverse effects. At least it gives a sense of well-being in patients. So here, the concept of Buddha is considered where it is said that vitiation of ahara, rutu, chitta, and karma. So these four factors is responsible for any type of disease, including cancer. If food is not correct, if there is an environmental impact, if our conscious is not correct, and maybe our past deeds, they all can have impact on disease manifestation. When I talk about consciousness, that is something very interesting concept. When you talk about intelligence, it is not just present in the brain, but in every cell we have something known as intelligence. If this is affected, then cells behave abnormally. Instead of going for a regular division, they will go for haphazard division. There will be high mitotic figures, uncontrollable cell division occurs. So a correction of cellular intelligence itself is required for preventing and managing cancer. That is why, in addition to all these medicines, we require other modalities which can include the meditation, pyramid therapy, pranayama, etc. Here we follow this line of treatment. We have a product known as Munex, a polyherbomineral product, which has received US patent recently. Here in Neprasha, there is a bioactive gold nanoparticles in drop form, a very good immunomodulator. Mahoshadha granules, that is developed as an antioxidant supplement. We use it regularly in those patients who are concurrently on chemotherapy and radiation. We follow Ojokalpa, that is a combination of various possible panchakarma therapies. In cancer patients, many a times it is very difficult to go for panchakarma. Many of the patients are not suitable for that. But wherever possible, we have found that Basti is very, very effective in case of cancer management. And supportively, you can also go for Dhara that helps to de-stress the patient. And pain management can also be done effectively with the help of simple panchakarma practice. Then, of course, dietary advice, lifestyle management, meditation, and a very unique pyramid therapy. I will not be explaining them in detail. Just one or two sentences on this Munex. which has got more than 50 herbomineral ingredients. Its safety is established. Its effect as anti-cancer in 12 different cancer cell lines is established. In Dalton cell lymphoma, it is established. In syngenetic Balbstein mice bearing tumor, we have observed that it improves the natural killer cell activity. Hiranyaprasha, it is a bioactive drop where gold nanoparticles are dispersed in a medium of organic honey. It is an immunostimulant, and we have observed that it is very useful in the case of leukemia. There are some studies which have shown that Swarna Bhasma is very useful in the management of leukemia. It helps in apoptosis, that is programmed cell death, in the case of lymphoblastic leukemia. Even in chronic myelocytic leukemia, I have used Swarna Bhasma and Swarna Bhasma containing Hiranyaprasha very effectively. Just a few sentences on dietary advice I want to mention now itself, because according to me, this is the most important factor in cancer management. In my practice of last 2 decades, more than 600 cancer patients of more than 45 different varieties of cancer of various stages, virgin case to terminal case stages we have seen. I have seen that most of them do not have any bad habits like smoking or alcohol. Of course, there are few, but majority do not have any such habits. I have seen many young women who are suffering from different types of cancers. It is observed that most probably it is the vegetables and the fruits which are affected with high amount of insecticides are forming the primary culprit. There can be environmental pollutions, which is the second most important factor, and faulty lifestyle is extremely important. 50% of cancer incidences are because of this. There are many studies that have been carried out how diet has its own role to play in the management of cancer. So it is a separate topic. I cannot elaborate it now. It is out of the purview of today's lecture. I usually ask the patients to take well-cooked rice, gruel made up of rice, ragi or some millets, wheat porridge, rich vegetables, some amount of ghee, and out of vegetables, carrots, radish, beetroot, leafy vegetables like amaranth, spinach, fenugreek, then ash gourd, bitter gourd, ridge gourd, bottle gourds, snake gourd, pumpkin, tender beans, sprouted green gram, plenty of fruits like orange, sweet lime, pineapple, pomegranate, then greviola, banana, sapota, papaya. These are highly recommended. Grapes, even though grapes is good, I ask the patient not to take it because it has got a high amount of pesticides in it. Lifestyle management, where you follow dinacharya, ritucharya, etc. Then meditation, there are several articles published which indicate the role of meditation in cancer management. Pyramid therapy, we have a very unique pyramid which is built with the help of wood without any metallic particles with a specific dimension. It is placed perpendicular to north-south direction. Person is asked to sit inside and meditate or just concentrate on his normal breathing. We have seen that it is very good rejuvenative, anti-stressor. It helps for easy activation of tumor necrosing factor in the blood. So with this, some quick outputs on our approach that we are following. Now let me just target on the title Rasaushadhi in cancer management. I will be giving a few lists and the possible indications considering the paucity of time. In some other occasions, we will try to discuss them more. Let them go in details based on some classifications. I will begin with bhasmas. We know that in general, rasaushadhi are considered as superior. Swalpahimatra vipula gunasha sadyohita deepanapachanascha. Alpamatropayogitvaadaruchehe aprasangata kshipramanagyadayitvadaushadhibhyo adhiko. In low dose, best and quick result you can expect in rasaushadhi in any of the diseases. That too in cancer. Rasaushadhis are considered to be excellent, unparalleled. I am starting with Raudra Rasa here. You can see Raudra Rasa, which is mentioned in Bhaishajya Ratnavali and Rasindra Sara Sangra also, may not be bhasma directly. Here, Kajjali is processed with different liquids and it is subjected to Laghubutta. The product may be Murchana or it may be a type of bhasma also we can say. This is a well evaluated product. It's a pharmaceutical study, analytical study, it's in vitro studies, it's a clinical study are all carried out. Raudra Rasa, I have found it in my clinical practice also as very effective in oral, oropharyngeal and up to esophageal cancer. The dose is 1 rati, say around 125 milligram. Ideally in a single dose, better morning and empty stomach with honey. Second product which I would like to highlight here is Somanathi Tamra Bhasma. Somanathi Tamra Bhasma, where you are preparing Tamra Bhasma either by Kupipakka method or a Sarav Samputa method, where in addition we have Haratala and Manashila as the components, is very safe and very effective in managing lung and liver cancer. 2 to 4 rati, that is 250 to 500 milligram is the regular general dose that we follow. Maximum up to 750 milligram you can give it with honey. Depending upon the location of the disease, you can give it in a particular Aushadha Sevana Kala. Hiraka Bhasma. Many of Vaidyas who claim to be very successful in managing cancer, they use Hiraka Bhasma frequently. Even the Patanjali Yoga Pitha, they are also using Hiraka Bhasma. There are some proprietary medicines available in the market like Unja Pharmacy has got a product, Cruel capsule, that also contains Hiraka Bhasma. And one of my juniors, Dr. Upendra Chala, he also worked on Hiraka Bhasma. The Hiraka Bhasma is highly acclaimed, but may not be as effective as it is claimed, but definitely it is useful in the management of cancer. It's quite expensive. The dose is very less, 2.5 to 6.5 milligram. Usually it is given along with Rasasindura, Makaradhwaja or Abhraka Bhasma and also Madhu as Sahabana. In a number of varieties of cancer as a supportive drug it can be used, especially in lymphoma and leukemia, it is very useful. You can use this as chemopreventive, that is for those patients who are already under chemotherapy. To minimize the adverse effect of chemotherapy, Hiraka Bhasma can be utilized. Abhraka Bhasma, really very useful as a supportive drug. May not be a very strong cytotoxic drug, but very good rasayana, very good supportive drug in cancer management. About 1 to 3 rati of Abhraka Bhasma you can use. Usually it is given with honey, but according to the location, according to the srotas involved, suitable anupana you can select. So my clinical practice also, I usually use it in lung cancer and also in blood cancer, which may include leukemia and lymphoma, and it is definitely very good chemopreventive. In lung cancer-like conditions, it is used with other churnas, like say Sitwapalladi churna, Talisadi churna, or Lagusutta Mishrana. Along with that, we mix this Abhraka Bhasma and we utilize it. Very good rasayana also for lungs. Swarna Bhasma, 15 to 30 milligram administered with honey or any specific anupana. It's also a wonderful drug in many types of cancer, but most useful in blood related cancer and also lung cancer. In leukemia, in lymphoma, that too non-Hodgkin's lymphoma, and in lung cancer, Swarna Bhasma has got very, very important role to play. It's also a very good chemopreventive. Vanga Bhasma has got very unique indication in stomach cancer, which is one of the very tough cancer to treat, because stomach cancer, most of the occasions, is identified quite late. Once the patient develops hepatic metastasis, or once he develops severe vomiting, or a firm swelling which is palpable over abdomen at epigastric region, only when you will identify that patient has got stomach cancer, then it's already advanced, and oral administration of medicine becomes very difficult in such patients as they regurgitate, they throw it out. But in earlier stage, if you can detect, Vanga Bhasma is found to be effective. About 1 to 2 rati of Vanga Bhasma with Madhu and Grita has to be mixed and administered. Vaikranta Bhasma 5 to 10 milligram is found to be useful in cancer related with Garbhashaya, maybe cervical and ovarian cancer. In Khalviya Rasayana, we have Vasanta Kusumakara Rasa, which is again not specifically targeting on cancer, but as a supportive drug, as a rasayana in CA liver and pancreas, and also in the case of renal cell carcinoma, it is found to be useful. Shiva Gutika, I have found it useful in intra-abdominal tumors and also cancer of urinary bladder, because in Gulma and in Basti Roga, Shiva Gutika is indicated. It is rich in Shilajatu. You have to give it in a very high dose of at least 6 grams, ideally once daily before food. So even in CA pancreas, I have used it. In hepatocellular carcinoma and urinary bladder cancer, it has given good results. I cannot say that curative, but I could extend the lifespan and quality of life of patients. Karpura Rasa, this is only for academic interest, because unfortunately Karpura Rasa is not permitted nowadays. We have couple of such formulations which contain bhanga or ahifena as ingredients, but they are not permitted. In other countries, cannabis is given permission for cancer management. So because of this restriction, we have lost many such wonderful formulations. Karpura Rasa is useful in intractable diarrhea. In some stages of colon cancer, it is impossible for you to stop diarrhea. In such situation, Karpura Rasa is very effective. Kanaka Sundara Rasa, about 2 rati, can be used in CA stomach and CA colon. Sarvanga Sundara Rasa, 250 milligram with honey before food, in a case of uterine cancer. Madhumalini Vasanta in lung cancer and bone cancer. In bone cancer, I am also using Vasanta Malani, Vasanta Malati, Swarna Malini Vasanta, Madhu Malini Vasanta, Apurva Malini Vasanta. All these 4 are useful. In my practice, I am using usually Swarna Malini Vasanta in the case of cancer of bone, which is very, very difficult. Osteosarcoma is extremely difficult to manage by any system. But to some extent, you can handle it with the Swarnamalini Vasanta. Then we have Chaturmukha Rasa, 1 rati, stomach and lung cancer. Arogyavardhini, very commonly used in liver cancer, skin cancer. Skin cancer responds very well for Ayurvedic management. I have a patient whom I am treating for last 10 years. He has got only 1 or 2 lesions left in his hand. Is absolutely fine. I am using Arogyavardhini in him frequently. Gandhaka Rasayana, in skin cancer, it can be adopted, but you have to give it in the full dose. It has to be prepared as per the text. Shuddhobalir Gopayasa Trivaram Tatushchaturjata Guruchikadbihi Atyaksha Dhatre Ushada Bringanir Bhavyoshtawaram Pratagardrakena Siddhe Sitam Yojayatulya Bhagam Rasayanam Gandaka Sanjitam Syat. All those 88 bhavanas are to be given. Add equal amount of Sita, then only it is Gandhaka Rasayana. Classical dose is 1 karsha, 12 grams, or at least 1/4 of this, 3 grams you have to administer in the case of skin cancer, and even in the case of CA lungs, it has shown good results. Swarnamalini Vasant, I already mentioned, in osteosarcoma, I tried it. Even in leukemia, it is found to be useful. We have Panchavaktara Rasa in leukemia and lymphoma, Jayamangala Rasa, which I am using in leukemia, especially in those patients who are presented with fever. Pyrexia of unknown origin, Jayamangala Rasa acts very well. If none of your regular medications like Sudarshana or Amritarishta or Mrityunjaya Rasa, Trigonakirti work, Jayamangala Rasa works. 1 tablet of 125 milligram with Madhu, you have to give morning in empty stomach. Gandamala Khandana Rasa is used in lymphoma, non-Hodgkin's lymphoma, papillary carcinoma of thyroid, and other soft tissue tumors in a dose of about 2 rati. After food, usually it is given with Savarchala Lavan. Even Lakshmi Vilarsa Rasa is used as a supportive drug in lung cancer. It doesn't have a direct impact on cancer. Nityananda Rasa I am using in all those cancers wherever lymph nodes are involved. In papillary carcinoma of thyroid and lymphoma, it is more effective. Under Kupipakwa Rasayana, we have Mallasindura. You have to be very, very careful when you use it. Do not give it more than half rati with madhu and ginger juice. At a stretch, you have to give it only for 2 to 3 weeks. Then you will have to give a break. Otherwise, it can cause some adverse effects. Tamra Sindura 1 to 2 rati twice daily with honey or Nagavalli Rasa in liver and lung cancer. Makaradhwaja about 100 milligram or 120 milligram with honey. Sometimes we mix it with Sitopaladi Churna and honey and administer in lung cancer and also as a chemopreventive. Rasa Sindura 1 to 2 rati as a chemopreventive and in lung cancer. Samira Pannagarasa about half rati. Again, it also contains arsenic, so you have to be very, very careful. With madhu or Rasa in skin and lung cancer, we use it. Under Parpati, Panchamrita Parpati, I use frequently in CA colon. In combination, Panchamrita Parpati with the Jiraka Churna, Amalaki and Yashtimadhu, I administer it with Madhu and Krita. Sarveshwara Parpati is found to be very, very useful. My friend Dr. Gopi Krishna uses this frequently. It's very difficult to prepare Sarveshwara Parpati. Almost all Maharasa, Uparasa, Sadhana Rasa are there. And it's very expensive also. In multiple types of cancer, especially cancer of oral cavity, Sarveshwara Parpati can be used in a dose of 125 milligram with Ardraka Rasa and Marichachurna. Rudra Parpati is a very interesting formulation which is to be prepared in Karapaka form. Here, this is the only Parpati where Karapaka is indicated. With Bhrangaraja Rasa and honey, it is given in lung cancer. Pottali I am not using so regularly. Tridhatu Garbha Pottali, Abra Garbha Pottali, Hema Garbha Pottali and Lokanath Rasa are indicated in different types of cancer. Practically, it is observed that Hema Garbha Pottali in a dose of half to 1 rati is very useful in lung cancer. Along with that, even Shilagarbha Pottali is found to be very effective in managing lung cancer along with honey. There are incidences, there are small germ cell cancer of lungs with the help of Hemagarbha Pottali and Shilagarbha Pottali. So this formulation is not frequently available in the market. We have to prepare ourselves and use, and definitely this has got much more clinical importance in future practice. I will just show you a couple of research works that are carried out. This is on Swarna Bhasma on cancer by Saumin Das and others. So they studied in about 43 patients where Swarna Bhasma was used for 1 year. And in different types of cancer, they have tried that In rectal cancer, 70% of patients responded very well for Swarnabhasma. 41.02 patients had a survival period of 1 year, and 15.38% people could survive beyond 5 years. As per international standards, if you are able to make your patient to survive for 5 years, you are very successful. So these are the various types of cancers: lung cancer, gallbladder cancer, liver cancer, pancreas cancer that were tried with this Swarnabhasma. This is another study where a comparative study of a cellular entry of incinerated ancient gold particles and chemically synthesized gold nanoparticles were studied. I'm not elaborating this. You can go for Nature scientific reports for this article. It has become very, very popular. This article has clearly established that gold particles that are present in Swarnabhasma can enter the cancer cells. They enter by two different mechanisms. One is pinocytosis, and another one as regular gold nanoparticles, that is clathrin dependent receptor mediated endocytosis. By these mechanisms, it could enter the cell and show it action inside the cancer cell and destroy it. This is another study on Arkeshwara Rasa, a herbomineral formulation, which is found to be useful in the management of certain types of cancers, and especially pancreatic cancer, which is most challenging to treat. In any conventional type of cancer management also, CA pancreas has got poorest prognosis. Arkeshwara Rasa was found to be very useful, but here the study was a preclinical study. The study has shown that human pancreatic cancer cells are highly sensitive against Arkeshwara Rasa, which is measured through the growth inhibition and LDH. This is a study on Bhalataka oil and Raudra Rasa in Galarbhuda or laryngopharyngeal carcinoma, where 20 patients were studied. 47.05 patients did not respond, but more than 50%, 52.95% patients responded very well. There are many works carried out on Raudra Rasa. If you are interested, you can go through that. Bhavara Bhoot was the first lady who worked on Raudra Rasa on management of cancer of head and neck through Raudra Rasa. She worked in association with oncology department at Rajkot. Then Dr. Deep Singh Chawda, my classmate, he worked on this Balataka oil and Raudra Rasa in the management of Arbuda. Then Lokhandwala, again, also worked on the same effect of Balataka Taila and Raudra Rasa on Galarbuda. Ramesh Kumar worked on physico-chemical analysis and anti-proliferative activity of Raudra Rasa. And in our institute, Dr. Gautaman worked on the pharmaceutical standardization, analytical study, and also in vitro anti-cancer potential of Raudra Rasa. So there are many such scientific papers that are available, and due to the paucity of time, I'm not able to explain all of them. Before concluding, let me just share my experience in one or two cases. I have huge data of cancer case reports. So I will not go through all those details. I will just pick up one or two just as an inspiration. This is a case, a 68-year-old Muslim male from about 50 kilometers a distant place from this Manipal, a known case of adenocarcinoma of right lung with IHV and IDDR. So when he came, he had breathlessness, cough, fever that started about 2 months ago with chest pain. Initially, it was suspected to be pneumonia. He had pleural effusion. It was a known case of diabetes mellitus for 2 decades, history of seizures, cardiac bypass was done. His bronchoscopy confirmed adenocarcinoma. He was treated with some antibiotics. bronchodilators, and then he was referred to oncology, but he did not go to oncology. He came to us. When he came here in 2008, June, we started giving him our research product Munex tablet at a dose of 2 TID, another research product Munistamine at a dose of 2 TID, then a combination of Laghusmuta Mishrana, which is a product prepared by combining Sitopaladi Churna, Gairika, Shunthi, Shwasakutara Rasa, then Makaradhwaja, Ashwagandha, Yashtimadu Churna. This combination he gave quarter spoon thrice daily with warm water. In addition, we advised pyramid therapy, pranayama, and also dietary advice. This is how we started. I have every follow-up details, so I cannot finish that now. After 2 weeks, he had the incidence of 2 hemoptysis for last 2 weeks. Chest pain improved, fever disappeared. I added Navayasaloha and Rodantibasma and continued. For his diabetes mellitus, I gave insulin. We continued pyramid therapy, Nadi Shodhana Pranayama. In next visit, his cough got reduced. Still, there were 2 incidences of hemoptysis. Continued the same medicine, added Chandrakala Rasa 1 tablet twice daily. In next visit, cough and dyspnea was reduced. 1 incidence of hemoptysis for 20 days. Continued the same medication for 20 days along with pyramid therapy. We could see that cough and dyspnea got reduced, no hemoptysis. And we continued the treatment like this. In the month of November, that is after 4 months, breathlessness was better, cough was markedly improved. Later, we could stop many of these medicines. I maintained him only with Munex, insulin, and Trifalachon. What we could observe is, after a period of 5 months of treatment, his CT scan of thorax showed very good improvement. There was no cancer lesion, only emphysematous changes and fibrosis was there. Chest X-ray, we repeated after 6 months, it was within normal limits. There was one lymph node calcification over light scan. And after that, even after 1 year, patient was apparently asymptomatic. He had some renal dysfunction. So I gave him Muniprabha, that is a fortified form of Chandraprabha, and we continued. His blood sugar was within normal limits. His serum creatinine came to normal. He continued the same medicine for 2 more years. And that is even after 12 years, there are no signs of cancer. So this is an X-ray. Here you can see bronchogenic carcinoma lesion. So this is after about 6 months, lesions disappeared. There are many such success stories with us. This is a case of non-Hodgkin's lymphoma, a 28-year-old boy, high-grade large cell type of non-Hodgkin's lymphoma. He had 1 or 2 chemotherapy. He could not tolerate. He discontinued and came to us. We monitored him with this regular CT scan, LDH, USG abdomen level, and I treated him very simple. I gave him only Kanchanara Guglu, Arogyavardhini, and also our Munex. We mainly concentrated on, this is the diagnostic criteria. We concentrated on LDH level for follow-up, which is found to be normal till date. For last 14 years, this gentleman is under regular follow-up. He is totally asymptomatic. Similar case we have here also. This is a similar case of non-Hodgkin's lymphoma. Then we have a leukemia case. a 21-year-old boy diagnosed a case of chronic myeloid leukemia. Since 2012, we are handling him. When he came here, he had low back pain, pain in thighs, intermittent fever, and pain abdomen. He is asymptomatic with the normal WBC count and morphology. And mainly we are concentrating on BCR, ABL translocation assay, which is beyond detected limits. That means he is not having any active cancer in his body. There is another similar case, 29-year-old male, chronic myeloid leukemia case. In both these cases, my initial prescription was this: Munex, Punarnava Mandura 1 BD, Arogyavardhini 1 BD, Kanchana Guglu 1 BD, then Jayamangala Rasa once daily with honey, because both these patients had a presentation of fever. Once the fever got subsided after 2 weeks, I stopped Jayamangala Rasa and I continued other medicines. After 2 weeks, I found that there are no palpable lymph nodes. I stopped Kanchanara Gugulu, then I started Panchatikta Vrita Gugulu. Panchatikta Vrita Gugulu has got a unique action on Astivasrotas and Majjavahasrotas. Leukemia, multiple myeloma, all these conditions have got their bone marrow affected. In all these bone marrow related cancers, I have found that Panchatikta Vrita Gugulu is very effective. If possible, you can go for Basti with that, or at least orally, you can administer it. So in this condition, within a month, the patient was asymptomatic. So currently, we are using only Munex tablet to him. Rasnadi Gugulu, I gave him for the management of low back pain, as he had L4, L5 disc protrusion. That is a different pathology. These are his reports. You can see here his BCR ABL assay 0.009%, which shows total remission. So this is another case of 57-year-old lady from Pune who had ovarian cancer, who was operated, but there was a recurrence with omental deposits. She came here with gross ascites, tense ascites, breathing difficulty, general debility. Her CA 125 level was a bit high initially, which got improved later. She had loss of appetite, vomiting, pain abdomen. We could treat her successfully. For last 7 years, she is under regular follow-up. Her first prescription was Munex, Kanchanara Bugulu, our another proprietary product Muniliu Plus, Amadugha, and a combination of Amalaki, Yashtimaldu, Guduchi Sattva, and others, Punarnavashtaka Kashaya, etc. That is how we started. I cannot explain you the whole details. My idea is just to inform that there are many such success stories where we could successfully manage cancer patients, but it is not with a single product or a single line of management. This is a patient, 54-year male of pancreatic cancer with hepatic metastasis. We could manage him for more than 5 years. So we have another case, 72-year-old gentleman from Sirsi who had oral cancer, operated, recurred. He had a big hole here on the cheek. He could completely heal. And for last 5 years, he is happily visiting our hospital. Of course, our treatment changed from time to time, phase to phase. So whenever we talk about cancer management, it is very difficult for me to explain a general line of management because patient to patient, our approach will differ. In general, we can say that we require a primary medication which can have anti-cancer potential. We need dosha-oriented approach, srotas-oriented approach. We need rasayana, and definitely only medicine will not help. You will have to incorporate other procedures wherever possible, dietary advice, lifestyle management, and most importantly, counseling. If patient is positive and happy, he responds to the medicine very quickly. Otherwise, as it happens in modern oncology, the situation in India is so bad that these patients are treated very badly in modern oncology, and they are so dreadful and afraid of the treatment. That is why many of the patients, they run away from the oncology and they collapse once the chemotherapy is started. Sorry that I am running very quickly. I am not in a position to explain all of this. So let me conclude today's lecture. Ayurveda has a lot to offer in cancer management. You have to follow a scientific, holistic approach. Never feel lack of confidence. That is happening many times when a cancer patient comes, Ayurvedic people are afraid. You should never be like that. We have a lot to offer. Patients expect a lot from us, but never go for a tall claim. Don't say that I'm going to cure this, I'm going to do this. You should have a proper knowledge of contemporary science also. There are many occasions where modern oncological approach is most important and effective. If person with the CA breast comes to you in stage 1 or stage 2, let her go for surgery. It can be 100% cure. Do not go experimenting on the patients. So never feel bad, never show lack of confidence. There are drawbacks in modern oncology, but definitely there are lots of positive strengths also. So assure the patients, but never give tall claims. So perception is awareness shaped by belief. Beliefs control perception. Rewrite beliefs and you rewrite perception. Rewrite perception and you rewrite genes and behavior. I am free to change how I respond to the world. So I change the way I see the world, I change my genetic expression. So always remember, we are not victims of our genes, but we are the masters of our genetics. We can modify genes by giving proper suggestions. So cancer has got a genetic aberration, abnormality, which can be very well handled by our holistic approach. With this, let me conclude. Thanks for this opportunity. Sorry if I could not cover all the topics as per your expectation. Thank you very much for this opportunity.
Thank you, sir, for your brilliant lecture on Herbomineral drug and its impact on cancer. We are more than honored and humbled to have you as a guest speaker out here. And it was really indeed an eye opening a session for us, because you have talked about some major issues and how you have classified and the groups and also the kind of drugs you have used. Especially you have talked about Munich, how it is beneficial in so many cases. And also besides Munich, you have talked about rasa aushadhis, bhasma, and other drugs, purpati, etc. And especially the cases you have discussed out here and how those patients have been benefited out of your medicines. So thank you, sir. It was really an overwhelming experience for all of us, and we are very much honored to have you here today. And now the session is open for people, those who have any queries and questions for sir to ask. And interested participant can share their questions through chat box. And also here is an announcement. Students, teachers, and scholars, those who are from different colleges and participated in this session, they can share their name, designation, and email ID through this chat box. So now the session is open for everyone. If you have any doubts and queries, you can ask, sir.
Good afternoon, sir. Myself, Datta, Rajiv Gandhi Memorial Agraricultural College. Sir, one question is arises. I have done this work under Professor Chandola sir at Jamnagar.
Right.
Sir, I have seen that patient is mainly complaining that the reduce of the pain. Major of the patient suffering from the pain. So, is there any specific medicine or any combined medicine in Ayurveda that we can reduce the pain in cancer patient? Sir.
This is a very, very good question, and this is the most challenging aspect also for us.
Yes,
This
sir.
is what I am facing the managing cancer. Am I audible?
Yes, sir.
Okay. Yeah. Nice to see that you are the student of Dr. Chandola. I am also the student of Dr. Chandola. I am also alumnus of Jamnagar. So what we do here, we are not just following the medication for management of pain in cancer. We have multiple approaches nowadays based on our previous experiences. So we are adopting some other palliative approaches apart from oral medication. I have seen that in many of these cancer management, simple gugulu preparations, they are not at all effective, especially in neurological pain. We know that when we talk it in terms of modern pain management, there are two kinds of pain that are expected in cancer. One is the nociceptive and the other one is the neurological. For nociceptive, like anti-inflammatory analgesic approach will hold good. For neurological, our approach should be different. Accordingly, in modern palliative care, they are using different types of analgesics or pain management. What I do is, if the patient is having a neurological pain, which is observed in most of the cancers, apart from inflammatory related pain, neurological pain is seen in many of the occasions. I usually use 3 or 4 drugs commonly. One is Vishamushti. We have a combination of Vishamushti yoga, which contains Shodhita Vishamushti along with that Rasa Sindhura. This combination I use in a dose of about 125 milligram twice daily with honey. Another drug that I use is Navajivana Rasa. Navajivana Rasa is useful especially in the case of oropharyngeal or head and neck cancer, where there will be severe root pain, unbearable pain, where Navajivana Rasa in a dose of about 250 milligram twice daily with honey has helped, because in Ardhava Bhedaka Navajivana Rasa is indicated. The other drugs which we had a very good result in our Jamnagar practice were Nidrodaya Rasa and Vedanta Kavati. But as I showed my concern in the beginning itself, we are not permitted to prepare them and use, because both of them are containing opium and bhanga. Whereas in Western medication, they are using morphine and other morphine derivatives. So that's about the drugs. There are other rasaushadis also, even Unmada Gajankusha also I use in some type of brain cancer where there is unbearable pain, but they are all used for a short duration. But apart from that, what I felt is when I go for some other additional modalities in our institutions, we follow Marmachikitsa, and also we take the help of other alternative system, that is acupuncture. Acupuncture and Marmachikitsa, when we combined, it helped a lot in patients who have severe pain, especially in the case of skeletal metastasis. They helped us a lot. And another very interesting observation that I could find is Vatahara Basti is also useful in reducing pain. In hepatocellular carcinoma, when pain is severe, even in the case of CA of urinary bladder, Basti has helped a lot. Dashamura Kashaya containing Basti helped a lot for pain management, which gives its result in 3 to 5 days. However, individually it changes, but still I am very sure that still I am not able to handle a number of painful situations which are even very difficult for the palliative care people when they give multiple doses of morphine to handle the pain situation.
Okay, many thanks. Thanking you, sir, for your valuable guidance.
Sir, I have a question. One more question, sir. Myself, Dr. Rumade. The question I want to ask you is like, when a patient comes to you, and especially a patient of cancer, how do you diagnose or classify the condition, and how severe the case is, or based upon the prakriti of the patient or the sattva of the patient?
Now, this is a good question. So we have to be open on either aspect. So one is purely classical approach of Ayurveda, and second is modern oncology. If you are totally blind on oncology knowledge, then you will be caught. You will have to face lots of problems. At the same time, we should not leave our classical approach. Presenting symptoms based on which we diagnose, whatever is the presenting symptom, based on which we diagnose. Then, as you rightly said, when we consider Prakriti and Sattva in cancer management, Sattva forms a very, very key and important place or important factor that decides the prognosis. And many of the patients who are coming to me, patient party, they say that I have not informed that my relative is suffering from cancer. If he comes to know, he will collapse. So such situation will be there many a times. So that is very challenging for us. So sattva is a very, very important factor. Even though the disease is not so severe, when patient is having weak sattva, it becomes very difficult for us to manage. But in Ayurveda, what I have observed is whenever patient comes to Ayurveda, he will have that positive vibes that is created. Half of our work is done there. Whenever they go to a cancer hospital, many oncologists are so rude, so rough. They just tell that in 6 months you are going to die. It's already stage 3 or stage 4 cancer. But our approach should not be like that. So we diagnose based on the presenting symptom. We definitely take care of srotas involved. We take care of dhatus involved, dhatuva tattva. We also consider prakriti of an individual. That is very important, not only for prognosis, but more importantly, for the selection of drugs. At the same time, sattva is given much more importance. Our treatment starts by boosting sattva. At the same time, very important is you should understand as per oncology what is the stage of the disease. Do you require any other investigation? Do you have to go for a PET scan? Do you have to go for other markers for investigation to find out the prognosis of the disease? And do you have to recommend some other parallel medicine or treatment modality from oncology to the patient? This you should not neglect, otherwise you will be causing problem to your own patient. So this is what I want to suggest to everyone, that have your classical approach of Ayurveda, but don't be blind about other oncological aspects.
Thank you, sir. Sir, I have one more question. If you have time, will you be kind enough to answer?
Sure.
Okay. Sir, it has been seen that there are a certain section of people who misuse rasa aushadhi.
Yes.
And the thing is that they have found some articles or some easy way out of finding a medicine, and they're consuming it for months and years without knowing its pros and cons.
Exactly.
So what we can do to stop such practices?
This is a very valid question, and it needs a very huge deliberation also. Now we know that entire globe is watching Ayurveda, Ayurvedic approach, Ayurvedic medicines. And after that infamous article of JAMA, it is found that not just the rasaushadis, even the herbal products also contain heavy metals, they can be dangerous, so many things. That is a different issue. On the other side, there are many Vaidyas who are not even qualified also, who are just using some basmas, mixing them without knowing about the pros and cons, without knowing the quality of these products. Any of the rasaushadhi which is prepared as per the quality standards will be safe. But then also, even when it is prepared properly, even in such situation also, it can turn into dangerous if it is not administered in a right dose, if it is not administered in a right person, if it is not administered at a right time with the right anupana and for a specific duration of administration. Many of the kalpas which contain arsenic will have to be administered only for a specific time period, then you will have to discontinue it. So there are many such things. Even if it is the best type of medicine, cumulative toxicity is possible in the case of rasaushadhi. Always these rasaushadhis should be made compulsorily as a medicine to be sold only with proper prescription. Without a prescription by a qualified Ayurvedic physician, none of the rasaushadhis should be made available. That is what I feel. There should be a strict legal constraint for this. And an awareness should be created among the people. It is not that a fear tendency should be created where all these rasaushadhis are going to cause heavy metal toxicity. And awareness should be created that these are the potent drugs, because people know that they say that steroids, so it is dangerous, but steroids are life-saving. But people know that they should not be taken as and when it is required. It should be taken under supervision. Same thing in the case of rasaushadhis. In rasaushadhis, I always say my students, some of my students are there, I think, joined me. I say that it's more than these metals and minerals, it is the vishadravyas like Vatsanabha or Kupilu. They are more dangerous because these metals, they may cause some cumulative toxicity, may not cause acute toxicity, whereas other vishadravyas can cause acute toxicity. So none of these should be allowed to be used without proper medical supervision. If you are having that type of strict guideline, and also if you do this deliberation in various platforms and write some simple awareness creating articles in general magazines, that will definitely help in misuse of such rasaushadhis. Patyapatya, course, that is the duration of treatment, anupana, and individualized treatment becomes very, very important for rasaushadhis for their safe and efficacious use.
Thank you, sir, for your answer, and especially the way you have highlighted some of the global issues as well as the importance how we can restrict and check on the use of uh, herbomineral drugs
Hello,
in proper way.
hello,
Before I
hello. I
yes,
have one
Hello.
question. Can I
Yeah,
ask
please.
the question, please?
Sure, sure.
Hello, sir. Hello, sir. Actually, if by chance a patient got diagnosed with cancer, whether it is first stage or second stage or any stage, if we by chance can restrict the intake of sugar, that is madhura ahar, can we actually combat the disease from the cellular level? Because we know cells need glucose for their proliferation and their growth. So can we, if we restrict totally the intake of sugar, can we combat with this disease from the very beginning level?
It's not 100% true. It is partially true because such messages are being circulated in WhatsApp. I know it very well. Sugar, of course, is an enemy for cancer patient, but it doesn't mean that if you totally restrict sugar, you can combat the disease. Whenever I advise diet, I ask the patients to refrain from use of sugar, especially the white sugar or polished processed sugar, and also maida. So these contents have found to support the proliferation of cancer cells. And I cannot say that if you stop sugar completely, you can stop the disease there. But definitely it will help you to regress the growth of cancer. Along with other management, if you ask the patient to restrict sugar, definitely it will help a lot for the patient to come out of the disease very quickly. And anyway, this is a good point that you have listened, because in many of the modern oncology treatment, what happens is they are not giving much stress to these dietary issues, even though it is well understood nowadays that diet plays a very important role, not only for prevention but also in the management of cancer. So we can advise to restrict sugar. Of course, we can totally ask them to leave the white sugar. They can use complex sugars like starches or honey in their diet instead, and that will help in slowing down the progress of the disease. I cannot say that it will completely cease the growth of cancer.
Thank you, sir. So in connection with this particular question, I have also one more question if you have time. As I have seen in certain anti-cancerous drug, for example, serotonin, in case of non-small cell lung disease, they don't allow the patient to have grapes because they have seen some interaction with the particular drug. Have you seen such a particular case when while you're dealing with patients with herbomineral drugs?
Herb drug interaction, it is again a very huge topic to discuss. In the case of anti-cancer drug, suppose the patient is already taking any chemotherapy and coming to you. In such situation, you should understand about this herb drug interaction. Whereas if you are using some rasaushadis in your clinical practice, there are specific restrictions that are mentioned. In the case of Parada Prayoga, in Kshetrikarana and Parada Prayoga, we have a long list of restrictions that are related with some vegetables like Kushmanda, Karkati, etc., or maybe related with certain fruits, maybe related with the fishes, maybe related with some milk products. There are certain restrictions when you use some types of rasaushadis very specifically. But that is more important in the case of utilization of rasaushadi for rasayana purpose. Otherwise, you don't have to worry much about that. Some of these components may slow down or inhibit the absorption of rasaushadis. In the case of chemotherapy drugs, what I have observed is whenever patient is under chemotherapy, suppose if he is taking chemotherapy once in 21 days, in such situation, when person had taken chemotherapy injection, at least for 3 days, I ask him not to take any Ayurvedic product or other herbal products, because there is a possibility of interaction of certain antioxidants that are present in herbs and fruits, along with the absorption of cyclophosphamide or carboplatin, cisplatin like drugs. But some of the drugs, say Haridra, curcumin, they will improve the bioavailability of the chemotherapeutic drugs. Gomutra, it increases the bioavailability of cisplatin by 2.5 times. Kajali containing products, they increase the bioavailability of certain chemotherapeutic drugs. So in such situation, the activity or efficacy of such drugs will be enhanced also. So this is a very huge topic related with the herb drug interaction, but essentially to be understood. Hopefully, if we have some other platform, we can discuss more elaborately on this aspect.
Thank you so much, sir. It was really eye-opening session for all of us. Anybody have any question they can ask, or else we'll move on to our last segment. Okay. Since okay, fine. Please ask your question, Dr. Sadaf.
Good afternoon,
Good afternoon.
Good afternoon, sir.
Good afternoon.
So, any tips for patient approach and
Your voice is breaking, Dr. Sadaf.
So,
You can share your question through chat box. In case there's problem in speaking or this problem with the audio, you can share your question in chat box.
okay.
Please, ma'am, type your question which you want to ask. I guess there's a network issue and she's not audible. Dr. Sadaf, are you audible? Can you hear us? Okay. Since she is not able to put her question, I'm sorry, Dr. Sadaf, we couldn't do much about that.
Don't worry, Dr. Sadaf is my student. She can communicate me later otherwise.
Okay.
I can
She
see
has
here.
written her question. Some important tips as if we freshers start with OPD and then patient is approached to us.
I think she is talking about cancer specifically. May not be a general guideline for OPD practice, which is out of purview of today's lecture. So when patient comes to you, OPD seeking your advice as a cancer patient. Correct, yes, I have understood the doctor. So as a cancer patient, when it comes to you, even if you are a fresher, you don't have to worry. You study the case properly. When patient comes, many times you may not have a ready-made knowledge about the case. As you see the cases, you will understand more and more about the cases, because we have various types of cancer, different phases, different stages. So first time it may be a bit difficult for you. Go as per your Ayurvedic approach. Try to understand the condition in detail. You try to understand the condition in detail, go for detailed case history, take all the records with you. Definitely based on the presentation and doshic predominance and dhatu involvement, Srotas approach, we can start some treatment there itself. Remember, at least you may have to give some Deepanapachana drugs, which also act as bioenhancers for whatever the medicine that the patient is taking. Start with Deepanapachana drugs, then target primary complaint. The patient's primary symptom, if you target, if you give some result, then patient will come back to you. You target the primary symptom, maybe for a week or so. Then during that period, you can gather more information. You can consult with your teachers or higher authorities so that you can plan properly. You can think about whether you have to send the patient to higher centers, whatever it is. But whenever patient comes, you do not leave the patient as it is. You hear properly, collect all the information, diagnose it based on your Ayurvedic knowledge, and give some basic medicament for a short duration at least.
Thank you, sir. I hope, Dr. Sadaf, you have found your answer. And now we'll move to our next segment. If anybody has any question, they can ask, or else we'll move to our next segment. That is the vote of thanks. And for that, I will request Dr. Devdas sir to deliver his vote of thanks. Over to you, sir.
Thank you, many thanks, sir, for your tremendous, valuable, and spellbound lectures. We got too much knowledge from your topic. And Ayurveda, in the field of Ayurveda, there is not mentioned so many medicines in cancer like disease. From your lecture, we can learn so many things and so many medicine for management of the cancer patient. So again, I am very thankful and pay my special gratitude to respected Dr. Sathyanarayan, he sir, Principal and Director of the Munial Institute of the Science, Ayurveda Medical College and Hospital. So again, I am thanking you for delivering this lecture. So thank you, sir. And my special thank to our principal sir for arranging such type of program, and also Dr. Rumade and Dr. Samsul Islam for their effort. I am very thankful all the faculty members of our institute, and also my beloved student for participation. And now we can learn some medicines regarding the specific management of the cancer patient. In frontline, I have worked in the GG Hospital, Jamnagar. There I have seen so many patients are suffering after intake of the radiotherapy and chemotherapy. Minimum 10% patients are die during the therapy of the radiotherapy and chemotherapy. So in such condition, if we properly diagnose the patient and manage the case as per the guideline of Sathyanarayan BSAT, then it will very helpful of us. So again, I am thanking you all.
Thank
Thank
you,
you,
sir.
sir.
Thank you, sir, for your valuable input. With that, we are concluding our session. Thank you so much for joining us.